muscular emphasis. Overhead exercises. Common problem: rigidity in the shoulder girdle and/or rigidity in the thoracic vertebrae. What is the compensation? The pelvis moves forward, hip overextension. What is the reason for the restriction? The aim of the test is to diagnose range of movement of the shoulder joint inflection and to locate any sources of difficulty. Procedure: raise extended arms past the line of the head. Shoulder flexion angle of 170 to 180 degrees is the normal. What is non-normal condition? Angle smaller than 170 to 180 degrees. Possible reasons for limitations in the full range of motion: lack of range of movement as a result of rigidity in the shoulder, ligaments, fascia. Shortening of the pectoralis major will pull the arms and at the same time increase lumbar lordosis. Here we can see the pectoralis major muscle, colored red, and a pectoralis minor in pink. Shortening of the pectoralis minor. As the pectoralis minor is connected to the scapula, shortening in the muscle creates an indirect chain reaction. It limits the scapula and at the same time pulls and raises the ribs. In other words, when testing flexion, if the rib rises significantly, we can assume that the minor is shortened or that the pectoralis major is shortened. We'll perform a differential diagnosis to test the length of the pectoralis major. Hold the arms out to the side. If the muscle is normal or long, the cause is evidently a shortening of the pectoralis minor. A condition is possible in which the range of shoulder movement seems normal, but the movement actually comes from a lifting in the ribs. If we tighten or hold the ribs, the arms will be pulled back. In other words, the pectoralis minor is shortened. In addition to the pectoral muscles, shortening of the latissimus dorsi can also prevent a full range of flexion. Shortening of the latissimus dorsi will pull the arms away from the floor. At the same time, we will observe increased lordosis. Shortened latissimus dorsi with increased lordosis is compensation to allow the arms to be lowered to the floor. How will we know if lack of range of movement is caused by shortening of the pectoral muscles or of the latissimus dorsi? First, we will observe the movement of the chest and the lordosis, and in addition, check the length of the latissimus dorsi. We will simply lengthen it from one side and see how the other side responds. We'll bring the knees towards the chest, hip flexion, knees bent. If during flexion the arms raise, then the latissimus dorsi is shortened. It is possible that both the latissimus dorsi and the pectoralis minor are shortened. In this condition, the ribs will also rise, and even with flexed legs, the arms will be drawn upward. The next part will show additional reasons for partial range of movement. Flexing arm while laying on the back, muscular emphasis. Overhead exercises.